Dealing with a casualty with severe bleeding to the right forearm. Come in, look round, check for danger. Introduce yourself to the casualty and ask them their name. Assess the wound, making sure there's no embedded objects. Get the casualty to apply direct pressure to the bleeding wound and elevate the arm above the level of the heart. Explain to the casualty that you're going to treat them for shock. Get them out of the chair. Explain you're going to lie them down on the floor and you're going to elevate the lower limbs. Assist the casualty in doing this. Supporting them to make sure that they don't collapse and injure themselves further. Maintaining the arm height to reduce the blood flow. Explain to the casualty again that you're now going to elevate the lower limbs and the reason that you're doing this. This minimises the effects of shock. Get back down on your knees, reassure the casualty and call for assistance. Once your helper arrives, explain to them exactly the injuries of the casualty, get them to coordinate the arrival of the ambulance, bring other first aiders and continually reassure the casualty. Ask the casualty some questions about allergies, medication, any previous medical conditions. How did the accident actually happen? When they last had something to eat or drink? Continually reassuring the casualty. Once the first aid kit arrives on the scene, open the first aid kit and put on your gloves. Explain to the casualty what you're doing at all times, continually reassuring them. Take your sterile dressing, unravel the first section of the dressing. Explain to the casualty to lift their hand, apply the sterile pad directly over the wound, asking the casualty to assist you by holding the short tail of the dressing. Get the casualty to rest their arm, their elbow on your knee. This will give you better ease in applying the direct pressure bandage. Tie the knot over the bleeding wound. This helps to form a clot and helps to control blood loss. Check for circulation immediately after applying the pressure bandage. Ask the casualty how they feel, if the bandage is comfortable. Place the arm in the elevated position and apply an elevation sling just to support the bleeding injury above the level of the heart. Always work at the injured side of the casualty. Go round and tie the knot off. Never ever lean over a casualty, as you could trip and fall and injure the casualty further. After you've applied your elevation sling, the casualty's core temperature will have dropped because of the shock, and you'll have a space blanket, and you would apply that underneath and over the casualty.